Amina Malik Hussain, and I, in my voluminous dupatta, welcome you to another episode of The Coffee Table. It is pretty big, but it's nice, enjoying it. So today on the show, we have two doctors with us, because on The Coffee Table, we love science, and we love doctors, and we love having them on the set to ask them all sorts of questions about the things that we worry about. So today, we've got two doctors on the set who are also professors, so it's like a double whammy of doctors, and we are going to talk about vaccines. Why are we so terrified of vaccination? What's going on? What do we need to do? What are the things that we need to know? And all sorts of, myth busting is going to happen today. So joining us today on set is Dr. Tayyiba Waseem, who is a professor of gynecology at Services and Mid-City Hospital. And we've got Dr. Muhammad Abid, who is an assistant professor of medicine, a physician, and a gastroenterologist. So there's a lot of expertise today here on the sofa. Hello, doctors.
Hello.
Thank you for being on set today with me. Thank you for taking time away. We're always very sort of deeply aware that there are patients who are sort of like looking at their watches saying, where's the doctor? Where's the doctor? So today we want to talk about medicines. And Dr. Tayyiba, can you sort of very basically tell us to begin with that what are vaccines?
Vaccines are basically derived to protect from all of us from various bacteria and viruses.
Right.
So they are protective and they are the best invention of actually, I must say, science.
Yes.
Because if you see, polio has been eradicated almost from all over the world except for our country and a few countries just because of that vaccine. Otherwise, crippled babies and crippled people you used to see all the time.
Yes.
And similarly, tetanus vaccine that we give in our pregnant women, that has actually also lowered the incidence of neonatal mortality a lot.
Really?
Yes.
Wow.
Because that is very protective and it prevents neonatal tetanus and finally, obviously, saves the babies.
So, Dr. Abid, in your sort of experience, why are people so nervous about vaccines?
It is basically because of the mishaps that have occurred recently. And, the polio vaccine is one of the safest one around, especially the oral polio vaccine, which is an attenuated vaccine.
Yes, the
Sometimes
drops.
we come across immunocompromised people, and these are the patients whom we should not give oral polio vaccine to. So, some mishaps can occur, and there's a probability of 1 in 1,000 cases who can develop polio because of this vaccination. So, because of this myth, if it happens in a community, so it can propagate, the news can just spread like fire, and people, can develop myths about these things and all that. Vaccines are basically meant for protection.
Right.
Live attenuated vaccines, we have killed vaccines, and then some others.
So could you tell us what the difference is? So there's a live vaccine and there's an attenuated vaccine.
Live attenuated vaccines are the ones in which the pathogens are not completely killed.
Right.
So we can give them to patients who are not immunocompromised, whereas if patients are immunocompromised, for instance, diabetics above the age of 60, or someone who's had HIV, or who's had AIDS basically, these are the people in whom we should avoid live vaccines. We should give killed vaccines. For example, injectable polio vaccine is the way to go for them.
Okay, so the injectable polio vaccine is a dead vaccine.
It's a dead
It's
vaccine.
got
So
no
it's
sort of
no side
active
effects, yes.
germs or bacteria floating
Even the
around.
oral polio vaccine will have no side effects in patients who have proper immunity. All of us have immunity unless we're very old, unless we're diabetic at 60, or we've developed a human immunodeficiency virus syndrome. So these are the people in whom we should avoid live attenuated
But there's
vaccines.
so much nervousness about polio, and again, it's such a shame because if we are one of the only countries in the world who still has it, then we really shouldn't have it. This makes no sense for us to have it. And I think it would be really helpful for people to understand this, is that the polio vaccine, like you said, is perfectly safe for sort of 95% of the population.
We need to educate the people. They communicate with others in a way no other nation does. So we need to communicate to people that polio vaccine is perfectly safe.
Right.
We working in OPDs can hear a lot of stories about polio vaccines that someone might have, inculcated an organism, an agent in it, which might be used for family planning. That was
Yes, this was a big
something
sort of story
that was
about it.
communicated to me.
We are a nation making stories like and then spreading it like without confirming whether it's wrong or right. Scientific-based evidence.
And it's scientifically impossible for a polio vaccine to have any kind of scary secret birth control in it.
Oh, birth birth control is the only problem everybody is facing in our country, and that is why we are exploding in population, and we are the 5th most populous country now.
Quite right. And the gynecologist is telling you this: the polio vaccine is not birth control.
Please,
Nothing is going to happen.
Anything to do with it.
Yeah. So we have like 2 doctors telling you scientific facts here. So I really want to sort of emphasize this because everyone tends to sort of latch on to that. Like you said, 1 in 1,000. Those odds are tiny.
Yeah, there's very less. And this side effect can happen with any medicine, not only with the polio vaccine or any other vaccine. But I guess the conspiracy theories, they have some backing as well. I don't want to divert this topic. So it was very damaging that this incident also arose in our country. And something should have been done, if it was for polio in our country, and we are the only nation in the world who are still having polio cases, then such theories, shouldn't have existed here.
Quite right. And so we need to sort of do more active work in sort of alleviating
communicating
these
to
concerns.
people, educating the people that there's nothing wrong. And I guess celebrities and people from around the world, it's happening in KPK right now, that the politicians are drinking those, taking those polio drops on TV so as to, just eradicate the myth. And it should happen more frequently, more in those parts of this country where the myths are more. And celebrities should come forward, the politicians should come forward, and I guess that's the best way to communicate and educate the people.
To sort of, garner a sense of trust about this whole process. So, Dr. Taiba, around the world, there's this whole sort of general concern with an anti-vaccination sort of campaign, let's say, has come up in the world, and they're called anti-vaxxers, where a lot of people believe that vaccines are actually detrimental to our health, and that there are a lot of dangerous things associated with vaccines. What do you think about
Actually,
that?
all vaccines have some little or more side effects, actually.
Right.
Like children are being vaccinated, sometimes they develop like fever, or they sometimes develop rash or something. Sometimes they develop hypersensitivity to the drug. So all these things, ultimately, when you talk about it to the other person, that my child developed that, my child developed that, they're just spreads. But that is, I think it's one of the duties of the vaccinator as well, and the doctor who's providing the vaccine, just to tell that these things are going to happen, and it's perfectly normal related to the vaccine. I think that's going to allay the myth of the patient or the mother who's bringing that child. And we in our busy OPD sometimes are just putting in the vaccine and just letting the mother go without telling that this baby is going to have fever tomorrow, and it's maybe persisting for 2 to 3 days. And then the baby might develop diarrhea or any nausea, whatever feel like.
Because some vaccines do have, like you said, it's a live vaccine.
Yes.
And obviously your body will have some kind of reaction to it, which is perfectly normal.
That is normal for a person to have. So if you educate the women, educate the person who's getting the vaccination, then I don't think so people will have that much of a trouble.
And it's also tricky for us because, like you said, in like public hospitals, for example, there's a huge influx of patients, and there are not enough doctors dealing with a lot of patients, and being able to sort of communicate that information might just be difficult.
Yeah, and it's very true. You see, one of my maids didn't get her children vaccinated just because of the fact that everybody said around her that vaccination is not good. But that ultimately led to so many, her children got mumps, her children got, one of the child, her mother got rubella. So ultimately this was simple one vaccine, and the best and the most important thing is that these are free of cost.
That's very important.
But this
is public hospitals.
Yes, they are provided free of cost to every person.
Free.
And
anybody can go with their child and just be like, can you please vaccinate them?
Yes.
And you will get that vaccination for free. It literally will just take a few hours of your day because you probably have to wait for the doctor.
Yes, but obviously the vaccines are there to help your child.
Yes,
it's not obviously going to damage your child. Anything which is damaging for any child, so that obviously won't be propagated by the government any doctor.
Or any doctor. It would just be irresponsible for a doctor to push. But this is also something that, this is a conversation, also part of this vaccination thing, is that medical companies keep developing different vaccines, and then they sort of push it onto us and, be like, oh, get vaccinated for this and get vaccinated for that. And do we really need all the vaccines that are available in the market? Do you think that it's necessary to get all the vaccines, like chickenpox, for example?
This shouldn't be debated because vaccines are only developed after the development of a disease.
Right.
For instance, we have had an epidemic of hepatitis A and E recently, and there is a vaccine for hepatitis A.
Yes.
It's not before the onset of disease, so their interest is not to be maligned, So if they can offer prevention against a disease, which is obviously better than cure, I guess they are the proper people to communicate this to us. Apart from the side effects of the vaccines that Dr. Taiba mentioned, it's also the delivery system that is faulty.
Okay.
They require
And
a
what do you
certain
mean by
temperature.
delivery system?
The vaccines require to be transported at a certain temperature, in a certain packing. Sometimes the polio workers or some other healthcare workers that are traveling to far apart areas in our part of the world, they don't travel with proper kits or they don't travel with proper things. So we come across side effects that are not, that are not expected. That are not, so these are the things that should be, communicated and should be propagated properly. Because if there are side effects that are not originally mentioned in the vaccine profile, then obviously the temperatures would not have been controlled and the delivery system would not have been managed properly. So speaking about the vaccines, you just name a disease. We've had an epidemic of enteric fever, typhoid. We do have vaccine for typhoid. And since we did not, as a population in general, we did not expect this, we did not give this vaccine to people. So there were so many people who had suffered from typhoid fever recently.
Quite right. And it's really bad.
Last year we had influenza, and even our families, had to take the flu shot. And that was the way, healthcare workers could have, avoided this influenza virus. And so if there is something that the pharmaceutical companies have to offer that is for prevention of a disease, then I don't think so. An example is rotavirus vaccine. It wasn't available in Pakistan until, I guess, January last year. And it was being done all over the world, in Dubai and all, in the Gulf states.
And what is rotavirus for?
Rotavirus is for diarrhea. It causes diarrhea in children.
Right.
Now,
so
after
is it
that...
I'm sorry to interrupt, but is it a kind of particularly vicious diarrhea? Because when you hear it generally, like as a layperson, you think, diarrhea, everybody gets diarrhea. So, but this is sort of like dysentery level diarrhea.
Yeah, rotavirus causes diarrhea in infants.
Right.
And this diarrhea is sometimes difficult to treat. I don't say you can eradicate diarrhea completely by giving this vaccine, but at least you could eliminate one virus. The
That's
same
really
goes
important.
with
I think
the
that's
same
really
goes with typhoid. You can eliminate typhoid with Salmonella typhi, but paratyphi is another strain that will cause typhoid in patients. But then if you could, 50% coverage is given, then that is half good.
That's pretty good. 50% is pretty good. So I think that's an important thing to remember.
And after that, people traveling from Gulf countries used to, take it, used to purchase rotavirus vaccines. And now from last year, January, I think rotavirus vaccine is now included in EPI in Pakistan.
What's EPI?
So EPI is a program of immunization that is carried out in hospital levels and all that.
Okay. Like for all children.
In Pakistan, yes.
That gives the free vaccines to
all
over Pakistan. In every BHU, the government should be praised for that because it's given in every basic health unit, RHC, in periphery, in government hospitals.
Wow, that's a pretty sort of vast network.
Yes, that is covering the community
areas.
all over, but it's just in a walking step to the patient's home.
Fantastic. We're just going to take a quick break and talk more about needles when we come back. Stay with us. Hi, welcome back to the coffee table. We're talking about vaccines and getting shots in your arm and other places just to keep you safe. But I think the operative word here is being safe. Dr. Taiba, I feel like, now as a layperson, again, I feel like vaccines are particularly important for us in Pakistan because we're also exposed to a whole lot of unsanitary conditions that people in the West may not necessarily be exposed to. Like Dr. Abid said that we've had an outbreak of typhoid, and typhoid is directly caused by contaminated water. Now, maybe somebody living in a developed Western country will have cleaner water than us, but we all need to get our typhoid shots because our water isn't clean. And
that's true.
All sorts of other things happen to us as well. I'm really surprised about the influenza as well because I always thought, what's the difference between influenza and just a normal cold?
Actually, influenza, this influenza that it has played havoc last year, I think H1N1 infection that ultimately cause so many deaths. It's different from a simple flu. But flu vaccine is one of the biggest invention, I must say, and I will recommend all people to get it.
Right.
And it is a new vaccine comes every year for the new strain of virus. So
because it
every
keeps
year a new strain.
mutating.
Yes.
Wow.
And from November to March is the time to get a new vaccine, and it is safe in pregnancy as well.
Okay.
So pregnant women can also have a flu shot if they want. And regarding the important vaccination for women, one is that MMR vaccine should be given to every girl, because rubella is one of the known reason for abnormal babies. And it causes, yes, if you
German measles.
German measles, yes. If you get rubella virus, which is pretty common, and you are pregnant, then it is one of the indications to terminate your pregnancy as well, because it can cause congenital defects in the child, like deafness, like cataracts and some. And if you fail to recognize it, so then obviously you're going to have an abnormal baby. So rubella vaccine should be given to every girl, and it is generally given at 9th month, and then it is repeated at 1.5 year of time.
But if for example, you've missed that,
you can get it any time before you're getting pregnant.
Okay, all right. So that's comforting that even if you didn't get it as a child or even as a young person, if you're planning and wanting to have a baby, then you should definitely get your MMR.
Yes, you should get this rubella vaccine before you plan to get pregnant, so that one catastrophe is avoided. And second vaccination that is recommended for all young girls is the HPV vaccination. That is to
Which is a fairly new vaccine.
It is a fairly new vaccine, but obviously the only reason that is curtailing its hampering its being more common is just because it's expensive and it is not available in government setups. Otherwise, it is one of the prevention of a cancer. The only thing that can be prevented, cancer can never be prevented by anything. The only vaccine available against cancer is
so that you get
vaccine.
So you get a vaccination for the HPV virus and
before you are sexually active.
Okay, all right, and that's immense, But I can see, but speaking of the MMR, and there was this whole sort of global controversy around the MMR, which has long since then been debunked. But there is, and obviously I'm sure you're aware of it, is that there was a doctor who put together this study which was just patently untrue, that MMR may cause autism in children.
Yeah,
that's not true, is it?
But it wasn't, it wasn't.
Yeah.
It wasn't put to trials, and it wasn't tested for that. Later, in this present era, in social media, you can put anything. You can also tell about copper sulfate or something like that, which is safe, which is not. So you can propagate any news, but unless it is tested and verified by the FDA or something else, it should be continued.
And the FDA debunked this, and I think that the doctor who sort of did that study, there was a lot of data inconsistencies, and this is something I just want to sort of put out there, is that apparently it's a correlation that children who do develop autism at that age, but 2 or 3 years old, is that when it's sort of diagnosed?
Don't know exactly, but I don't think so. The theory was practical,
No, it wasn't. So apparently there was a correlation in the sense that, or is it causation? I'm not sure.
No. It was not.
The age that you get the MMR is also the age where usually you are diagnosed with it.
It's not done after 2 years. MMR is finished after 2 years.
Yeah.
It is done in 9 months.
Yeah. So after 2 years, it's not given, basically.
Yeah.
So basically, there is no correlation. Autism, it's still being processed, still being investigated. Then what's the actual cause of autism? And still, it's theories all around. No conclusive evidence has been drawn.
So this is just sort of, again, it's speculation to say that a
and a non-valid one, I think,
can cause this.
Because this vaccine is there for years and years.
Yes. For almost 3 to 4 decades.
Yes, 3-4 decades is there.
Wow, that's a long time, like 30-40 years.
Everybody of us has been vaccinated, and our children and children and children. And autism was never a problem because the vaccine has been always been there.
And a vaccine that's been around for this long, it's unlikely that it's actually definitely causing a condition like this, especially one that's on such a sort of broad scale, that the spectrum is so vast.
Yes. It is included in the National Program of Immunization for every country. I guess it's 1974 it was, when the API came into being, and 26 and 19, I guess 44 years, and nothing has happened. So this theory wasn't practical.
Right. Okay, that's good. It's good. I think it's sort of comforting to know that one can, because again, it's better to have a safe child isn't it? A sort of a child that doesn't have to unnecessarily suffer from any sort of terrible disease. And
Obviously.
in the world, like measles has come back with a bang because of a lot of parents who don't want to vaccinate their children. And that's incredibly dangerous because, and again, I don't want to be like the lay person telling the doctors that, oh, you know measles. But Dr. Abid, why is it dangerous? Why is measles dangerous? Why is it dangerous that so many people in the world are now getting measles? It's unprecedented. There hasn't been this much measles in the world for like past 50 years.
It's basically the contact now. It spreads through respiratory droplets and all that.
Right. So if someone sneezes on you or coughs in the area,
you're about to get measles then.
Right.
Considering this part of the world, Pakistan, I would speak about. In the last 4 to 5 years, I've been working in emergency and services and all that. We've suffered from the most outbreaks. I haven't heard of any country who has suffered from Ebola. We've suffered from dengue. We've suffered from XTR typhoid, the recent enteric fever, which was a very difficult strain to treat. And we've had patients, we had fevers, like patients would present to you with fevers for 2 months and 3 months.
2 months?
And then we used to treat them, and then some of them would develop complications such as enteric perforations and all that. So, and then we've suffered from influenza and all that. So it's basically this part of the world that needs to be actively looked after. Some rules should be put into place if people, are not willing to immunize their children. They're basically creating risks for other people as well.
Yes.
If you look at the migration that has happened from KPK to Punjab, now we see that some areas in Lahore are also having a polio virus detected in them. Where did this come from? This comes from people who have traveled from there to here, and they haven't vaccinated their children. So the sanitary conditions, the virus gets detected, and suddenly a whole population of that area is now in danger of contracting polio virus. So some rules at the government level should be put into place that if people are not immunizing their children, either they should be isolated or there should be some penalty for this, because ultimately they're creating risks. If someone is not immunized for measles and he's going to the same school as my kid is, so he's bound to develop measles as well. And then this will spread in children of every age. So this is the main reason that it is happening.
So herd immunity protects everybody.
Exactly.
And I speak to people who are a bit skeptical about vaccines, and they say, okay, well, it's not a big deal if I get measles or if my 15-year-old gets measles. But herd immunity protects tiny babies, protects old people, it protects people who are immunocompromised. So that's why everybody needs to be immunized.
And I think one thing that Avais said, actually, another important thing to be looked into is that like hepatitis E virus, like it just had such a bad outbreak, and it's so dangerous for the pregnant women as well. Every other day, a woman coming with this hepatitis E. And there is this water the people are drinking.
Yes.
Government needs to look into it, that from where it is being
Where is it coming from?
Where it's coming from, and sanitation conditions are definitely not good. That is why that virus is spreading. And one key message to you, but the simple boiling of water at home, if you can't afford the mineral water or something like that, is not that big a task. But people are not aware that water can do that bad. So in addition to vaccination, I think the source should be eliminated as well. So people should be very particular, because the people, we are very bad at hygiene, I must say.
Really?
But we as a nation, we don't wash our hands. Many people don't wash when they use public toilets. There is no place to wash their hands. And in toilets, if you see, the one of the most neglected thing in our country is toilet. If you go to any public place like parks, there is one toilet or hardly two toilets, and there are hundreds and thousands of people coming, and there is one basic necessity, and you do not have any hand wash after that. So that with that hand, you are carrying any bacteria or virus with you, and then you just go and do something else, and it is transmitted. So important thing is hand washing should be emphasized to the children at school. One thing, and then obviously vaccination comes the next, and thirdly, obviously the water. We are all waterborne diseases ultimately, which are causing such a problem to us.
And is that how epidemics happen? How do you define an epidemic? Like, how many people have to get sick for it to be an epidemic?
It's basically an area where a disease spreads unusually. For instance, we didn't have typhoid to such an extent. We used to have it in this rainy season in August, September. And we used to have hepatitis A and E in this season as well. But we have been experiencing this from March, I guess. Yes, March, April, this came in, and it's still, we still have so many people. And we've had pregnant females with hepatitis C as well. In pregnancy, the mortality of hepatitis C rises from 5% in a non-pregnant person to 20-25%. So the mortality raises about 4 to 5 folds. So it's basically the same point. If waterborne diseases,
yes, the only virus that can kill a woman, that is hepatitis E. A, B, C don't.
A pregnant woman.
Pregnant woman.
Yeah.
Oh my God, that's terrifying. And then again, it's waterborne.
Waterborne disease, yes.
And we don't know that even if you're drinking boiled water for food, with your food or in cooking, but if you're not having a shower with it, and you're not brushing your teeth with it,
and you are not washing your hands properly with it.
It has basically happened to people who have taken homemade foods, We go out to restaurants and all that. That's the biggest recreation we have in Pakistan.
Of course.
And then the sanitary conditions and, the washroom facilities, obviously. So if your cook isn't washing your hand and all that, so these waterborne diseases, you're bound to get them. You're bound to contract.
Right. So as sort of people who employ other people, it's also incumbent on us to create awareness about this and to encourage everybody to wash their hands. Yes. That's so easy.
That's so easy. And this is such a big, simple step that should be told to every person whosoever uses toilet, that whenever they have to come back, they have to just wash their hands.
Yeah, and I think that's an interesting point also about public toilet facilities, public sanitation.
Yes, we are very poor in that. And if you see in slums and in these areas where people generally live, they live in rented houses, like 4 or 5 houses, renting 100 people, but in one room there are
with a great deal of density.
And you have just one toilet. Everybody has to go to that toilet, and that toilet, what will happen to that toilet after 100 people use it?
Quite right.
There was recently a research in India where 20 to 25% of the Indian population doesn't have washroom facilities at all.
So sanitation is something that's really important, and I
you
didn't
can
consider
see
that before.
You go to any public park and you can see what the toilet facility we have.
Yeah, gross. We're just going to take a very quick break. Stop talking about toilets for 1 minute, and we will come back very soon. Hi, welcome back to the coffee table. We're talking to 2 very intelligent doctors about vaccinations and why immunization is so important, especially for us here in Pakistan. So a lot of our diseases seem to be waterborne ones. So a way to combat that is naturally to then sort of look at our water facilities and sanitation facilities. And that's one quite direct and fairly easy way to prevent a lot of diseases happening in Pakistan. So one thing also that I'm curious about when we talk about vaccines is that vaccines have heavy metals in them, and those are also supposed to be detrimental to one's health.
No, I don't think so.
Like mercury.
These are tested medicines. These are only approved by the FDA after they are being tested, after they were tested on a large amount of population. And if there is a side effect, FDA has no problem in, just ignoring it. So after passing through so many trials and phases, phase 1, 2, 3, 4, then these are rendered safe. So those metals and those things have got absolutely nothing to do with our health.
Okay, so there are metals in there.
Yeah.
It's just part of the makeup of the vaccine.
Yeah,
but the FDA, which is the Food and Drug Association of America, right?
Yeah.
They're the ones who then test it millions of times on a lot of people, like 4 stages of testing, and that's when it's safe to use.
Actually, World Health Organization, WHO is basically concerned with obviously all these safety measures. All drugs actually pass through these trials. First they are tested on animals, then they're tested on humans, and finally 1, 2, 3, 4 phases they have. So vaccines are one very important domain, obviously, which are being given on mass scale to prevent a disease. Obviously, medicines are given to cure disease. So they have to be absolute, because anything, if they have a wrong material, that is going to question the safety of big organizations. So they can't do that.
Right. And then billions of people around the world can be compromised. So you're saying that the WHO takes its job very seriously. And everything that is that comes through is safe, and it's all right. And also, I suppose, when they say prevention is better than cure, that's obviously, it's much better. Like you said, if there's a 50% chance after a vaccine of getting typhoid, then Those are great odds.
You're very unfortunate. Yeah, even after vaccinating, you can get Salmonella paratyphi. It is less as compared to typhi. So if you're very unfortunate, you are to be, infected by that, then it happens. Otherwise, you will feel a sense of satisfaction that even after consuming food from outside, that you've been vaccinated for it. Yes.
You're all right.
And I think one thing I will definitely like to suggest to people concerned with this vaccine is that lowering the price of vaccine is very important.
Yes.
I really don't know how many are manufactured in Pakistan and how many are manufactured or we are importing them. Really,
I think we import a lot of them.
So, but these multinationals companies which are doing the vaccines, I think for common public, business always grows when you have lots of.
Of course,
there's a business model to have a low price and large number rather than a higher price and few numbers.
Quite right.
So I think if they are going to, because one of the hindrances to vaccine is definitely the price.
Yes.
For like this all vaccine, the basic EPI schedule, that's free, that's everybody's getting it. But for the typhoid, for the chicken pox, for the every measles, but the vaccine, you have to have a cost.
Right. So these are the ones that are outside of the EPI, the immunization schedule.
Yes.
So typhoid is one that's not included in it. Is hepatitis in that schedule?
Hepatitis B vaccine is included.
B, but not A and not E. Is there a vaccine for E?
There's no vaccine for E. There's a vaccine that has recently been developed for A. And there's another concept of post-exposure prophylaxis.
Right.
For instance, hepatitis B.
Lay people.
Yeah.
What's that?
Hepatitis B, you get vaccinated for hepatitis B in your EPI schedule.
Right.
Then you get tested for an antibody. If your levels are low, you can get a booster dose.
Okay.
And even after that, especially for healthcare workers, needle stick injuries do happen in our profession. If you get exposed to the virus, HIV and HBV especially, then there's a post-exposure prophylaxis.
Okay.
You need to get immunoglobulins within 72 hours for both these diseases.
Right.
Now, consider the dilemma, the social dilemma you could face when you get pricked from a person who's had AIDS, who's had HIV. So, if you get post-exposure prophylaxis, then the chances of you contracting that virus reduce to only 2%. It has 98% efficacy. So, the first part, the first line of defense should be vaccination. The second line of defense is post-exposure prophylaxis. You've been exposed to the virus very badly. You don't want to get that virus into you.
Quite right.
Then you can get those immunoglobulins done. Immunoglobulins injectable are available for hepatitis B, whereas oral drugs are available for HIV. But that only happens when you reach the concerned person in 72 hours. After 72 hours, there's no use of giving those vaccines. Even pregnant mothers the babies who are born to hepatitis B positive mothers, they're given immunoglobulins and then they're tested 2 to 3 months later. Most of them will, be okay after 2 to 3 months. They will not have hepatitis B.
So even if you are exposed to a disease like hepatitis or HPV or even HIV, which again, that's a whole different conversation to have also. How do you find out? How do you tell somebody? Yes. So you can retroactively get an immunization, and that will sort of really decrease your chances of getting a vaccine. Or getting the disease, not the vaccine. Of course, you get the vaccine. Those are great odds. That's fantastic. Like, why should you be ill for no reason?
Yes.
I think that's great. Now, apparently, there's a vaccine for shingles also.
Yes, there is a vaccine.
What is shingles?
Shingles is herpes zoster. It's a virus again.
Yes.
Virus is so tiny, but it causes havoc. Everywhere, every lethal disease is virus.
It's a viral. Oh God, yeah, scary. But there's a vaccine for that.
Yes.
So if you get herpes zoster and it's floating around in the air and you inhale it and you get it, and what happens to you then?
Then you develop shingles. That is the rash that is very painful, and fortunately drugs are available to cure it. And if you get it in herpes zoster in pregnancy, it can harm your baby.
Oh God!
So luckily immunoglobulin is again available.
Right.
So if you get it within 72 hours, then you are safe and you can carry on with the pregnancy.
Oh, okay. So if you feel like if you are having a baby and you have got herpes, but you get the vaccine within 72 hours, then you will sort of suppress it. And apparently it's very painful also.
Yes, very painful.
Because the sort of herpes preys on your nerve endings and everything is
it's very painful.
And also adults above 60 years of age who are not exposed and who have developed diabetes, they're sort of immunocompromised.
Yes.
They're more liable to develop shingles and all that. So they should be given vaccination. That's not post-exposure prophylaxis. That is just for their general health.
Preventive.
Yes.
Okay.
Shingrix is the name, I guess.
Right. Okay. So older people in one's household, one should watch out for that also. So Dr. Abid, in the EPI schedule of vaccinations, what are the things that are very, very important? Even if you are a little nervous about vaccinations, what are the vaccines that you must absolutely get?
Immunization schedule is the same for everyone. Rotavirus, as I said before, is recently included. You get oral polio vaccine, then you get hepatitis B vaccine, you get MMR. These are the three basic things that you get, repeatedly at 6, 10, and 14 weeks.
Right.
After that, the other vaccines are optional. You can
and
BCG, yes, BCG.
Yeah, BCG and DPT also for diphtheria and whooping cough.
Pertussis and tetanus, yes.
And tetanus.
Yeah.
So these are all super duper important ones, especially living in Pakistan, where we have all these sort of living conditions which are suboptimal at best. These are vaccines that all children should receive. And if you haven't received them as a child, can you get them as an adult?
Actually, BCG vaccination, I don't think so you can get in an adult, but
even MMR, you don't get it after 2 years.
They can, all the other vaccines, I think you should get whenever you get a chance.
Yeah, it's not optional. It's not what you ask them to do. It's something that you go to the immunization center and they'll do it by themselves because it's included in the program. And every baby who visits that center or who is at home, when the team visits you, so they take care of it. It's not an optional thing that you want to get a BCG vaccination or an MMR vaccination. It's in your schedule. You have a card and they do it.
Is it illegal to refuse?
Should be. It isn't.
I think it's a basic human right. Like eating is a basic human right. Washing is a basic human right. I think it's a basic human right to prevent against the diseases that can cause you much harm.
So as a parent, these, at least if nothing else, these are the baseline vaccines that all children should receive.
And they're free of cost. The best thing is that there's no cost involved. You just have to get it.
I think a lot of times it's not always about the money, but it's about worrying, parents worrying that will this cause something worse in my child? What if something bad happens?
You should also think of the other children as well, because if there's someone who's illiterate and who's refusing these medicines, basically, he's not only a danger for himself, he's also a danger for the entire community.
This is crucial.
So this should be looked after by law. There should be some law in Pakistan and countries like Pakistan where the literacy rate is not that good. And there should be communication that if you're refusing this medicine, you're not only creating problems for yourself, but also for the other people in the community. So the disease burden basically increases. And then the cost of treating that disease burden, in some country like Pakistan, where the financial burden for treating diseases is already that much, it creates more problems.
So we should work on prevention actually.
And awareness. It shouldn't just be polio awareness, it should just be general immunization awareness, that it is free. You can go to a government hospital, and get it done. Apparently teams can come to your house.
Yeah, they do. Nowadays,
in community, they do.
And it doesn't really, and you're right, like a virus, it doesn't matter if you're sort of, eating fresh fruits and vegetables and drinking clean water. A virus is a virus. A virus doesn't care.
It doesn't care how much healthy you are, he can always enter your
just jump on you. So thank you so much, both of you, for being on the show and dispelling so many myths about immunization and vaccination and giving us so much really valuable information about this. Everybody who's watching this, I'm sure, has benefited greatly from this. This is all information that we all need to know. Again, remember, this is a community. This is almost, I would even go so far as to say this is our civic duty as citizens of a country and as part of a community, is that when we all vaccinate, we all keep diseases at bay so that nobody gets sick. And we're all safe and healthy together. It's great. Wonderful. Won't have to get measles ever again. Thank you all for watching. It was a pleasure to see you, and we will see you next time on The Coffee Table. Bye now.